Welcome back to Optimal Anesthesia, where we'll be discussing the intriguing topic of Sugammadex, the revolutionary anesthetic. We'll break down the research, investigate potential uses, and clarify the riddles surrounding this treatment. Whether you're a doctor or simply interested in healthcare, you won't want to miss this. Picture this: it's the early 2000s, and the world of anesthesia is facing a challenge. Traditional reversal agents for muscle relaxants aren't cutting it. The need for something better, faster, and safer is crystal clear. And this is where our story begins. In 2001, the first clinical trials for Sugammadex kick off. Back then, it was known as ORD-25969. These early trials were like planting the seeds of a medical revolution. Researchers and pharmaceutical companies saw the potential for a game changer. Fast forward to 2008, a pivotal year. Sugammadex is granted approval for clinical use in Europe and Australia. It was like the birth of a new superhero, Bridion, by Merck and Company. It became the answer to the anesthesia world's prayers. Sugammadex didn't stop there. In 2010, it made its grand entrance in Japan, marking a significant step towards global recognition. It was a groundbreaking moment, making Japan the first Asian country to embrace the power of Sugammadex. 3 years later, in 2013, Sugammadex expands its horizons once more, gaining approval for use in Canada. North America was starting to take notice of this remarkable substance. But there was a hurdle to overcome. The United States, a key player in the medical world, held out. In 2015, for the third time, the FDA rejected Sugammadex's licensing approval. Hypersensitivity concerns were the main stumbling block. It took 3 attempts, but the breakthrough came in 2018. The FDA gave its seal of approval, and Sugammadex finally made its way into the American medical arsenal. It was a victory for science and patient care. Sugammadex is like a molecular ninja. It has a hydrophilic exterior and a lipophilic center, making it perfect for encapsulating aminosteroid neuromuscular blocking agents, with the highest affinity for rocuronium. Once it captures these agents, it renders them inactive. But that's not all. Sugammadex also helps these agents detach from the neuromuscular junction, allowing your muscles to regain function. Think of it as the ultimate unparalyzer. Now, here's the tricky part: dosing. The amount of Sugammadex needed depends on the depth of muscle paralysis, the timing of the muscle relaxant, and the specific drug used. We categorize muscle paralysis into routine, moderate, and profound levels based on neuromuscular monitoring. For each level, there's a corresponding Sugammadex dose to ensure a complete reversal. Let's break it down. Routine block, TOF count 2 or more 2 mg per kilogram of Sugammadex, and you'll be back to normal in about 2 minutes. Moderate block, post-tetanic count 1 to 2, you'd need 4 mg per kilogram, and it takes around 3 minutes. Profound block, no response to neuromuscular monitoring. In this case, you'd require a higher dose, 16 mg per kilogram, and you'll regain muscle function in about 1.5 minutes. So, when does Sugammadex come in handy? Well, it's a superior alternative to neostigmine for reversing muscle paralysis, providing faster and more reliable results. Plus, it allows the use of rocuronium in rapid sequence induction, a technique used for quick and safe intubation during emergencies. You might have heard of succinylcholine, a muscle relaxant often used in rapid sequence induction. Sugammadex, when paired with rocuronium, can provide similar intubation conditions but with a longer duration of action. This can be especially useful in certain medical procedures. But here's a twist. Sugammadex has been considered as a treatment for rocuronium-induced anaphylaxis, a severe allergic reaction. However, its effectiveness remains a subject of debate, with some cases showing promise and others not. Now, let's talk about specific populations. Is Sugammadex safe for everyone? In the elderly, it's generally safe, but it might take a bit longer to kick in. For kids aged 2 to 17, Sugammadex is recommended, but it's not suitable for neonates or infants. Pregnancy and breastfeeding, not recommended during pregnancy, but some reports suggest it's okay after a cesarean section. In obese individuals, there's some debate on dosing, but a dose based on ideal body weight plus 40% appears to be safe. Patients with neurological diseases like myasthenia gravis benefit from Sugammadex, as it provides reliable reversal of muscle paralysis. It's also been used successfully in various neurological conditions. Patients with pulmonary and cardiac diseases can safely use Sugammadex, but recovery time might be slightly longer, particularly in cases of cardiac failure or heart transplant recipients. Sugammadex isn't recommended for those with severely impaired kidney function, but some studies suggest it could still work. Hemodialysis can be used to remove Sugammadex if necessary. While there's limited evidence for Sugammadex use in liver dysfunction, it's generally safe because it's primarily excreted through the kidneys. Sugammadex has a few quirks when it comes to drug interactions. It doesn't play well with ondansetron, verapamil, or ranitidine due to physical incompatibility. But its main concern is capturing or displacing other drugs, like hormonal contraceptives, which could potentially make them less effective. Finally, let's talk about potential side effects. Hypersensitivity reactions are the most concerning, but they're rare. Other common side effects include a strange taste in the mouth, headaches, nausea, vomiting, and hives. So, while it's generally safe, it's not without a few quirks. And there you have it, the story of Sugammadex, the superhero of anesthesia. We hope you've enjoyed this deep dive into the world of this remarkable medication. If you have any questions or want to learn more about any medical topic, feel free to reach out. Until next time, stay curious and stay healthy.